Hello, I'm John Lavelle. I work at Tennessee Orthopedic Clinics and I'm a spine medicine physician. If you're suffering from back pain, having pain throughout the back that's limiting the things you can do in your life, causing you struggle to get up in the morning or go to your children's games or get to work or sleep at night, I'm here to help you. Back pain is as common as getting gray hairs and wrinkles. Many people refer to it as degenerative disc disease, but it's not truly a disease. It's something that happens in our body as we get older. But just because you have this symptom of back pain from degeneration in the spine doesn't mean you have to have continual back pain, continual symptoms down the legs. We do certain things such as injections, medications, get you doing some functional exercise. I like to term it kind of functional rehabilitation, getting you back doing these exercises that you're struggling with. Just simple things like getting you up out of a chair is doing a simple squat. Lifting dishes out of the dishwasher, putting them up in the cabinet is doing a simple deadlift type activity. And that's what we want to help work with you on to get you back to doing the things you want to do. Lifting up your grandchildren, putting away the laundry. These are simple tasks that many people struggle with their back pain, and I'm here to help educate you on what's going on, what's causing it, and help reduce that pain so we can get you back doing all these activities.